Common types of arthritis and treatment options.
Hello there, and a warm welcome to the Arthritis Treatments channel. Before we start, please subscribe and click on the bell icon so you stop missing out on important news, reports, remedies and resources about arthritis. Okay, let's begin.
Do you or someone you know suffer from arthritis? It's a common disease, you likely do. What type? Only a doctor can tell, but there are over 100 different types of arthritis. Despite this large number, they typically fall into two categories. The first is osteoarthritis. This disease is most commonly found in men and women over the age of 65. It's also known as degenerative arthritis. This name comes from the progression of the disease. It begins with cartilage breakdown. The cartilage covering the bones degenerates and wears away. Essentially, sufferers have exposed bones. These bones then rub against each other, causing severe pain and discomfort. Many also experience difficulty moving. The most noticeable symptoms of osteoarthritis is joint pain. Stiffness is common in the morning and after movement. All joints can be impacted by osteoarthritis, but the most common are the hips, feet, back, knees, and fingers. Those with arthritis problems in the hands and feet may find it difficult to walk without a limp and grasp otherwise easy objects. As with most types of arthritis, there is not just one cause for osteoarthritis. There are many contributing factors. These include body weight, previous injuries, and genes. Although osteoarthritis typically affects the elderly, athletes who repeatedly use the same joints and suffer injury are at increased risk. As for body weight, the joints and muscles surrounding them carry most of the body's weight. More weight applies more pressure. Although rare, there are defects that can lead to osteoarthritis. These include a lack of protein that make up cartilage and poor fitting of bones and joints. The second is rheumatoid arthritis. Rheumatoid arthritis affects over 1 million people in the United States. It doesn't discriminate, as individuals of all ages are susceptible to the disease. In fact, there are 3 types of rheumatoid arthritis for juveniles alone. The cause? The immune system is supposed to protect our body, but in some cases it does the exact opposite. With rheumatoid arthritis, it attacks the joint lining membrane. The most noticeable symptom of rheumatoid arthritis is pain. If untreated, other complications can arise. The most common is disability. To prevent this from happening, all patients are urged to exercise their joints and muscles, even though it may be painful at first. Another common symptom of rheumatoid arthritis is inflammation. The swelling can be mild to severe. In most cases, this is what separates rheumatoid arthritis from other forms. Swelling and inflammation is likely, but it's much more prominent and debilitating. Luckily, rheumatoid arthritis sufferers rarely experience constant pain. The disease flares up from time to time. These flare-ups are triggered by joint overuse and certain foods. As for a cause, it's currently unknown. There are, however, many theories, one being genes. The third is fibromyalgia. Although not always classified as a form of arthritis, fibromyalgia is an arthritis-related condition. This disease affects over 3 million people in the United States. That number may actually be higher, but some patients are misdiagnosed. The most noticeable symptom of fibromyalgia is muscle pain. There are also tender spots in the muscle and body that are more susceptible to pain and pressure. Additional symptoms include headaches, bladder problems, difficulty thinking, fatigue, and sleep difficulty. While researchers have yet to determine a connection, a good percentage of those who suffer from rheumatoid arthritis later develop fibromyalgia. It wasn't bad enough that your joints hurt, but now the muscles in your body do too. Additional causes may be related to prior injuries. Some studies have shown that those with previous injuries are more likely to develop the disease. Many experts believe the change in muscles due to injury can later lead to chronic pain and fibromyalgia. Now that you're familiar with some of the most common types of arthritis, what comes next? If you or someone you know suffers from arthritis, medical care is important. A proper diagnosis is important to developing the best treatment option. Low-impact exercise can loosen the joints and strengthen the surrounding muscles. This not only eliminates joint stiffness, but it can later prevent disability and deformities. Finally, some pain can be treated, but it will reoccur. Those suffering from arthritis need to learn how to manage their pain. This involves not focusing too much on it, eliminating stress, asking for help, getting a good night's sleep, and learning how to calmly relax.
Well, that's it for now, folks. And thank you very much for watching the video. But, before you leave, has any of this ever happened to you? If so, please share your story in the comments below, and enjoy the rest of your day. Ciao for now.